This presentation is intended to describe what we refer to as the drug-nutrient interaction. This is not a comprehensive discussion, but there are some patterns that may help improve our understanding of the phenomenon. The Merck Manual of Diagnosis and Therapy is a best-selling medical textbook, which was first published in 1899. It's the oldest continuously published English language medical textbook. It's now published online. There's a consumer version, a professional version, and a veterinary version. From both the 1999 print edition and the current online edition, in the nutrition section under general consideration, there is a topic on nutrient-drug interactions. This source predates our observations with broad-spectrum micronutrients and medications. Both editions state that nutrition can affect the body's response to drugs. Conversely, drugs can affect the body's nutrition. Foods can enhance, delay, or inhibit drug absorption, and foods can change the metabolism of drugs. We do discuss these mechanisms elsewhere in our materials. In the clinical pharmacology section, in both versions, under factors affecting drug response are the following definitions and observations. Drug interactions are changes in a drug's effects, A, due to recent or concurrent use of another drug or drugs, drug-drug interactions, B, ingestion of food, drug-nutrient interactions, or C, ingestion of dietary supplements, dietary supplement drug interactions. Now, for the purpose of this discussion, we will use the term drug-nutrient interactions because we're talking about vitamin and mineral food components rather than herbs and botanicals or extracts that aren't typically part of the diet. Also under factors affecting response to drugs is this section titled pharmacokinetics. These are observations about variations in drug response due to individual differences in genetic makeup. So from the perspective of drug treatment, the authors present this diagram of factors that influence response to drugs through the nexus of genetic constitution. At Hardy Nutritionals, we realized that this same diagram can also explain the perspective of nutritional treatment and the factors that influence response to nutrition, including recent or concurrent use of certain medications through that same nexus of genetic makeup. You may also observe how closely some of these parallel some of the limiting factors that we discuss elsewhere in our materials. So the next question is, how is this drug-nutrient interaction observed? What does it look like? Well, these interactions have been reported in the literature. From the Journal of Clinical Psychiatry, one of the earliest publications on the micronutrient formula, we read, psychiatrists do not normally think of vitamins or minerals as modifiers of the effects of psychiatric medications, but the early anecdotal experience with this nutrient supplement suggests that there may be strong micronutrient medication interactions. This mineral vitamin supplement seems to generally potentiate the clinical properties of psychiatric drugs. From the Journal of Child and Adolescent Psychiatric Clinics of North America, we read, micronutrients potentiate the effect of psychiatric drugs, flooding the patient with adverse effects unless the doses of the drugs are concurrently lowered. Potentiation is about 3 to 5-fold. Lithium is a special case. Broad-spectrum micronutrients produce a 100-fold potentiation of lithium. This potentiation applies to virtually all drugs active in the central nervous system, including non-psychiatric medications. Following quotes come from Chapter 6 in Complementary and Integrated Treatments in Psychiatric Practice, published by the American Psychiatric Association. Transitioning from conventional medications to micronutrients involves a cross-tapering process, during which clinically prominent drug-nutrient interactions usually emerge. It is strongly advised that clinicians obtain training and/or supervision before attempting to transition patients taking conventional psychiatric medications to broad-spectrum micronutrients. Individuals who consume caffeine, nicotine, alcohol, or recreational drugs may also notice interactions with broad-spectrum micronutrients. We find it reassuring that these effects have been described in medical publications because we weren't the first ones to describe the phenomenon. And additionally, we are observing what could be described as replication or verification of what was described in the Merck manual. A simple illustration of what this looks like could be represented with these two figures: normal function on the left and function that is affected by mental health symptoms on the right. A medication is typically added to reduce dysregulated symptoms and improve overall function, and typically there are some side effects that accompany this. By contrast, if the same medication were given to a normally functioning individual, they would experience unnecessary drug effect, including side effects. When broad-spectrum micronutrients are added to the first scenario, we consistently observe two things. First, we see improved cognition, improved sense of well-being, and improved mood, and reduced anxiety and stress. But we also see, two, an increase in medication side effects, which indicates some change in the effect of the medication as described in the Merck manual. Interestingly, we do not observe this pattern in medication-naive individuals, which reinforces that that what is being observed is a drug-nutrient interaction. So let's conclude with a practical example. So here we report a customer history of a 39-year-old woman diagnosed with bipolar disorder at the age of 32 with her first pregnancy. At this point, she stops self-medicating and begins a consistent treatment for her diagnosis, which consists of lithium, dosulipin, and quetiapine. She began our products on the 13th of September 2019, started with greens and probiotics. And then on the 16th of September, she began the daily essential nutrients. By the 23rd of September, and this is quick, but by the 23rd of September, she reported an increase in side effects, including chills, fluttering or pounding heartbeat, headache, brain fog, confusion, difficulty concentrating, and irritability. So how can we ascertain that these symptoms are connected to the medications being taken and not just to the broad spectrum micronutrients? So I will point out again that we do not observe these kinds of symptoms in medication-naive individuals. To help the individual understand the connection between these additional symptoms that they are experiencing and the products that they're consuming, we ask them to check a drug database like drugs.com. So as we scroll down the page for lithium, we can see many of the symptoms that she describes. Here we use the National Health Service database from the UK for the dosulipin because drugs.com is limited to drugs that are approved in North America. And here too, we see some of the symptoms that she describes. And for quetiapine, again, we see some of the symptoms that she describes. So recognizing that these symptoms are connected to the medication or medications better helps the individual to identify and communicate that during the tapering process, which is referred to in the AP text or earlier publications. So again, by the 23rd of September, she reported an increase of these side effects. Now, she reduced her medications by 1/8, and within 24 hours, she described relief from these symptoms. This pattern repeated approximately each week until early December, when she reported her last doses of lithium and dosulipin. She remained on about 3 milligrams of quetiapine for an additional week. She again reported increased side effect and feeling relief after discontinuing the quetiapine. However, 2 weeks later, she reported feeling the withdrawal or discontinuation symptoms of electric shock sensations. She had reported that, interestingly, she'd reported similar symptoms when she had weaned off paroxetine more than a decade earlier. She reintroduced 1.5 milligrams of quetiapine and felt relief of the withdrawal symptoms. At this point, she further fractioned that dose weekly over the next 3.5 months, and by the latter part of April reported that she was medication-free and doing well. She recorded in her journal, and I'm paraphrasing, that her skin cleared up. She reported that her sleep had improved and she felt rested after sleep. She reported a sense of contentment that she had not experienced before. She also reported that her mood was stable and commented that this is what normal feels like. She reported that she no longer had that drugged feeling, and she was now able to experience a full range of emotions. She specifically noted that the medications took the edge off her negative emotions, but they also prevented her from feeling positive emotions. She also reported that she was better able to benefit from counseling. So these are just a few of the things that she describes in her journal. So I hope that this helped to improve your understanding of the observed patterns of drug-nutrient interactions and to some degree how that is managed. Thank you.